Today's medication is going to be epinephrine 1 to 1,000 or epinephrine 1 to 10,000, commonly referred to as epi, or you may also hear it called adrenaline. We're really going to focus today on covering allergic reaction or anaphylaxis. It's going to be an adrenergic, catecholamine, and it's also a vasopressor or a sympathomimetic. When we give the drug epinephrine or adrenaline in the body, through the route that we administer it, it's going to mimic the sympathetic nervous system. Epinephrine naturally occurs in our body. So that being said, when we give this, we're mimicking the sympathetic nervous system's response. This is going to tie into our mechanism of action as it's going to affect three main receptors. The first receptor is going to be the alpha-1 receptor. This is going to turn on the response of the vasoconstriction. Well, what is vasoconstriction? Well, what does vaso sound like? Kind of like vasculature. And constriction is the squeezing down. So when we squeeze down on the vasculature, we're effectively, by default, going to squeeze and increase the pressure throughout the vasculature in our body. Well, what does that mean? It means we're increasing the pressure. So by doing that, our blood pressure is going to increase. The second receptor that it's going to affect is your beta-1 receptor. This is going to increase the heart's contractility. It's going to do that through ionotropy, chronotropy, and dromotropy. Effectively, with the increased contractility, you're going to have an increase in heart rate. So beta-1 is going to also increase your heart rate. Beta-2 is going to affect bronchodilation and skeletal muscle vasodilation. The way we think of epi to affect beta-1 or beta-2 is you have one heart and two lungs. So beta-1 is going to affect the heart, beta-2 is going to affect the lungs. But like I said earlier, we're going to focus on epinephrine 1 to 1,000 as it primarily focuses on allergic reaction and anaphylaxis. So some of the pharmacokinetics with this is when you're administering this drug, IV route, it has a very rapid onset of action. It is inactivated by the liver, and when administering through sub-Q routes, epinephrine results in a slower absorption due to local vasoconstriction. Indications are going to be cardiac arrest, anaphylaxis, bronchial asthma, respiratory stridor such as croup, symptomatic bradycardia, or return of spontaneous circulation. Contraindications are going to be hypertension, and in the cardiac arrest setting, there are none. Adverse effects, you will find tachydysrhythmias, hypertension, and it may induce early labor in pregnant women. It may cause a headache, nervousness, and you may notice that rebound edema can occur 20 to 30 minutes after administration to croup patients. Lastly, it may cause tremors and shakes. Precautions when giving this: because of its increase in oxygen demand, we want to be cautious in giving this with our MI patients. However, we are not going to restrict epi when giving this for cardiac arrest. Epi 1 to 1,000 IV should not be administered to any patient, and you should also follow your local protocols as to how to administer this medication for your allergic reaction and anaphylaxis. When covering anaphylaxis and asthma, the suggested route of administration and dose is going to be 0.3 to 0.5 milligrams 1 to 1,000 sub-Q or IM. For pediatrics, the dose is going to be 0.01 milligrams per kilogram 1 to 1,000 sub-Q or IM with a max dose of 0.3 milligrams. When giving this medication, something to think about, we do not want to mix sodium bicarb or furosemide, also called Lasix, as this can deactivate the epinephrine. IV epi should be reserved for cardiac patients as that concentration is going to be 1 to 10,000. Also, when covering these medications, you'll notice that I have my cardiac epi in these types of vials. This is 1 to 10,000, and here we have 30 mLs of epi 1 to 1,000. When administering epinephrine 1 to 1,000, we want to be mindful that we're not using our cardiac epi, which is a concentration of 1 to 10,000. We want to make sure that we're going to administer epinephrine 1 to 1,000. You can find it in these small ampules, or you may notice that it's in the 30 ml tankers as well.